Hi, hello, my name is Benin. I'm the engagement lead for Cheshire Merseyside Women's Health and Maternity Program. This week is Black Maternal Health Awareness Week 2024. This is the 5th Awareness Week that 5 times more have curated. Each day fall under the overarching goal of advancing Black maternal health. Today's theme is Hyperemesis Gravidarum. To discuss this, I'm joined by my colleague, Jo Hunt. Jo is the lead midwife for health inequality. Hi, Jo.
Hi, Benin. Really happy to be able to discuss this topic with you today.
Yeah. I've got a couple of questions for you here, Jo. And
fire away.
Yeah. What is the hyperemesis?
So I'll probably refer to hyperemesis throughout this talk as HG. It's a bit of a mouthful, isn't it? So hyperemesis gravidarum. A lot of women will be familiar with the outdated term, which is morning sickness, and it is outdated, but also sickness can occur at any time of the day, so it can be quite a misleading title as well. And usually up to 90% of women can get some sickness and nausea in pregnancy, and that can not have much of an impact. You know, you can go about your normal routine, probably go to work, you know, and just carry out your normal tasks throughout the day without much hindrance. And symptoms usually ease in the second trimester, which is from around 12 to 14 weeks pregnant. But HG is a condition that starts early in pregnancy, usually before your gestational age of 16 weeks, and it's characterized by severe nausea and usually vomiting, an inability to eat and or drink normally, and it strongly limits someone's daily activities. The exact cause of it is unknown, but it is one of the most common indicators for hospital admission amongst pregnant women.
Oh yeah, people call it morning sickness, but I believe it's all day sickness. It's not only morning. Yeah, thank you for clarifying this. And when does it start and how long does it last?
So it can begin very early. Some women, particularly if people have had a baby before, they'll often get, you know, that nausea, the early nausea feeling before they've even done a positive test. And symptoms can peak around 9 to 13 weeks. They can improve around 16 to 24 weeks, but unfortunately for some, they may continue throughout the whole pregnancy. And for 1 in 5 people who have severe HG, they have symptoms, sadly, throughout their whole pregnancy.
Yeah, I believe so. Some women, they say all during the pregnancy. Yeah. Does the doctor or the GP or midwife give information to patient about this sickness?
So yeah, the doctor and midwife should really talk to you about this. You know, you should feel listened to and not fobbed off. You know, it can just be, you know, feeling nauseous. But for some women who do go on to get HG, you know, they find this very debilitating. And one of the risks of this is that they're not listened to, or they don't feel able to discuss that with a health professional, and they feel it's something they should just get on with. But in fact, it can have quite a negative impact on your life and your health. So if you do find that you're not being listened to, you could ask for a second opinion. Obviously, talk to your midwife or your GP or another trusted health professional. A peer support, or even have a friend or relative attend appointment with you if you need to. And of course, as always, if you do need translation services, this can be arranged, or information in different languages as well.
So good to know this all inclusive and in a different language. Yeah. And are there any specific populations or any specific group this sickness to occurs more likely in?
Well, in fact, as I said earlier, about 90% of pregnancies can be affected by some degree of nausea and vomiting in pregnancy, but around 3% will experience this very debilitating condition. The people that are more likely to get HG are women having their first baby, or if you're having a multiple pregnancy, such as twins, triplets, etc. And unfortunately, women who've had this before are more likely to get it again. And sometimes women who have a history of migraines, motion motion sickness, so if they get sick in cars or on journeys, etc., or if you've got a first degree female relative, your mum, you know, nan or sister or whatever, have had this condition, you have an increased risk then also, unfortunately.
Well, thank you, Jo, for answering this. Is there any medication or holistic remedies for it?
So there is medication to, you know, there is help on the horizon. It's not a one size fits all option, and it's important to remember there isn't a cure for HG just yet. There is some research underway, but for most people, treating the symptoms can go a long way in easing the worst of it. So often a combination of treatments is needed to get relief. So it might be anti-sickness and IV fluids. People who have severe HG are likely to be hospitalised multiple times during pregnancy as well. Sometimes they will need bed rest with a combination of the anti-sickness and IV fluids as well. Some women do opt for alternative therapies such as acupuncture and acupressure to relieve milder symptoms. But other things that can help for the more milder symptoms are avoiding the sensory stimuli like smells, etc., which women will often say is a big trigger for their symptoms. Having plenty of rest, eating and drinking little and often. Sometimes cold meals rather than hot meals can, you know, be tolerated a little bit easier as well. And, you know, some women do swear by having ginger, like ginger tea or, you know, in capsules or whatever, in whatever format, can help as well.
Yeah, like our mothers, they always ask us to drink and tea with ginger or have ginger with lemon. It helps, they said. What are the side effects of HG?
So HG can be very debilitating. It can cause weight loss. Obviously, she's vomiting. She's not being able to tolerate food. Or you know, the smells of food might, you know, be repulsive. You might not be able to eat or, you know, even think to eat at all. It can cause dehydration, which we know can lead to lots of other complications, vitamin deficiencies, electrolyte imbalances, liver and kidney issues, severe fatigue, like debilitating fatigue, which, you know, for if you have other children or you've got work to attend, etc., you know, that can have a real impact on your life. But it can lead to more serious complications also. And it's important to remember as well, it can have a massive effect on mental health too. And affected women are more at risk of depression, anxiety, emotional distress, PTSD, post-traumatic stress, reduced quality of life. And in very rare circumstances, women may opt for a termination of pregnancy of an otherwise wanted pregnancy, or they may have suicidal thoughts because the symptoms are so distressing. And I know we had a little chat earlier about this earlier on, Benin, but, you know, women have said it can really negatively impact on their family relationships, as a woman can be so unwell and be unable to take care, you know, undertake her tasks. And it probably takes away quite a lot of the enjoyment of pregnancy as well, particularly if it's your first pregnancy and you're expecting it to go a certain way. To then have a condition that is meaning that, you know, you're having these thoughts and your mental health is affected, you know, must be very traumatic for a woman. But just to make note, it's very important that you seek medical treatment if you're unable to keep food or fluid down, as you can become dehydrated very quickly. And sometimes IV fluids are essential to become rehydrated, and medication to try and stabilise your symptoms. Women often, their main concern as a woman is not themselves, it's often the unborn baby. But those with mild to moderate symptoms are unlikely to have any negative impact on the fetus, which is good to know. But women with HG and low can have an increased risk of preterm delivery. Often, you know, some of these factors are linked to the low pregnancy weight gain, etc. Low birth weight babies, small for gestational age babies. So it's important for both mum and baby that the condition is recognised, treated and managed effectively.
Oh, this is a lot for women. We women, we suffer a lot. So my last question, Jo, if the women struggle to do everyday activity, are they going time of work, for example, get sick note?
So as soon as your quality of life is impacted by this condition and you can't go about your usual routine, you really do need to seek some medical support. and the GP should undertake a full assessment, and they can rule out there might be other alternative causes for your nausea and vomiting. So it's really important that you're not fobbed off, or, you know, family members can sometimes say it's just sickness, do this, do that. It can lead to other complications, as we've talked about, but it could also be another condition. You really do need to go and get some help and support for there. And we'd like to think your employer will be understanding. You are entitled to time off your appointments in pregnancy or pregnancy related issues. However, not all employers would be supportive. So if you do find that this is, you know, you're not being taken seriously, or your employer is, you know, not being supportive, you could talk to your GP or midwife. But in more extreme cases, you could speak to Maternity Action. You can find their details on the internet, and they can help with support and to also understand your rights as well. There is also an organisation called Pregnancy Sickness Support, and that's got access to online help and peer support as well. And I think just don't suffer in silence. Please do go and ask for some help.
Thank you. Good to know all this. Yeah.
So I think, again, just to reiterate, we had a little chat, before we started filming. Both Benin and I, you know, we are women. We are mothers. You know, I'm midwife. I've come across this in my professional life, but we both have been impacted by this ourselves during our pregnancies, and, you know, recognize the you know, how debilitating it can be, how negative an impact it can have on your life. And, you know, I'd just like to reiterate that, you know, there will be people there to listen to. There is support out there. You shouldn't have to just get on with it. You know, it can be quite a struggle, and there's always something that can be done. So please do go and get help for this.
Yeah, also I believe people around you, like husbands, wife, sister, brother, they need to understand what the women going through, and not to think, oh, she just spoiled, or she just want to be off sick on bed. Yeah.
Yeah, I think as well, you'd mentioned earlier, Benin, as well, you know, that culturally some women can be expected to, you know, have deal with their pregnancy in a very private way, and, you know, not to ask for help. And, you know, we'd just like to reiterate, you know, that that's not so. You know, you need that help and support. You shouldn't have to just get on with it. And you know, there's plenty of support out there for this if you feel that you're not getting that from friends and family, or, you know, from your GP, etc. So yeah, thanks for talking with me today, Benin.
Oh, thank you, everyone, for watching our video. Before we go, we wanted to let you know about the Instagram live event on Friday 26 on the Improving Me Instagram. Please follow the account, which is A_T Improving Me 15. Our engagement, colleague Jenny will be going live with Davina Johnson, a birth trauma recovery expert. Thank you so much, Jo.
Thanks, Benin. Take care.
Thank you.